simply assume that they can hold those costs to 0 or 2% without telling you how to do it, I think is not very helpful. Because I gave the 4 unpalatable ways you can actually hold the government spending. I gave unpalatable ways you can actually hold government spending down. But we as citizens are not going to put up with with being denied access to life-saving, health-enhancing services. And so we're either going to pay for it through our taxes or through special health levies or whatever, or we're going to pay for it out of our pocket, and that has distributional consequences. But you can't assume the problem away. And what I'm afraid of is you look at the provincial budgets and even the federal budget, but more the provincial budgets because they directly have to deliver the service day in and day out. They've assumed away a problem, and you cannot assume it away. You really have to say how you're going to deal with it. I mean, this is what I just said. We need an adult discussion of how we're going to do it. And it probably will involve something of all of those 4 elements that I talked about, none of which we like, but even less will we put up with being denied access to health services which we know are there, which the health system is capable of delivering to us. We just won't put up with being denied that access. And it's especially true of, if you will, the younger elderly, the 60 to 80-year-olds, right? Especially true of them because much of the new services we developed over the last 50 years are things that make their life better. And they won't put up with it. A, they vote, and B, they have some money of their own. And so they're not going to put up with being told, you can't get your hip fixed, go buy yourself a fancy new car. They really want to trade the fancy new car to get their hip fixed. And they're not going to be told that they can't do it.
Are you concerned?
No. It's a question of how we're going to do it. We can either pay for it publicly or we can pay for it privately. But what we cannot do is promise people that they can have the service and then they find that they can't have it because we can't deliver it. We're going to have a debate, as I said, a real debate about how we're going to deliver. Obviously, there are efficiencies, but what I was warning about is let's not count that we're going to have huge gains. But yes, we should exploit efficiencies of having special clinics because doing things in a general hospital is generally more expensive and considerably more expensive way of delivering a service than delivering some services, not all, some services, than delivering them in specialized facilities. So that's a efficiency question. But even if we were brilliant and we could get productivity gains, if you will, in the same order that we get in other sectors of the economy, let's say 2% a year, even if we could do that, our total spending on health would rise roughly 1.5 times as fast as national income when we look out to the end of this decade and to the next decade. So we just can't wish the problem away. We have to do it. Look, none of them are palatable, but I'll tell you what no government will survive if they promise a service and can't do it. You can get there without raising taxes. You can't. You have to be honest that what that means is you're going to reduce the services you provide. The one piece of dishonesty is to say everything will be done by getting rid of waste and efficiency. It just cannot. So yes, you can balance the books by curtailing expenditures. But that means the services that governments deliver to you and me are also going to be curtailed. And we can't kid ourselves about that issue. And so that's why I say we need to have a real debate about how we're going to deal with this, and not. I don't want to be too critical, but we kind of are wishing the problem away by assuming that we can curtail expenditures without curtailing the real services that governments are providing to you and me as citizens.
You think